My name is Allison Weiss, and this is my Leading by Teaching assignment. I will be giving directions to patients in a patient care setting about personal health. What is personal health care? Personal health care includes managing the care of all aspects of your life, including physical, emotional, psychological, and spiritual. All of those aspects work together to form you and are essential to personal health and development. It includes preventing disease, promoting wellness, and being proactive and completely involved in your health care and being self-aware. So what are the goals of personal health care? The first one is to be completely involved in your care. Make decisions with your provider together. Participate in shared decision making. Do not have your provider entirely decide your plan for you. Be sure to stay involved and speak up when you have ideas, concerns, and questions. Stay as included in your care as much as possible. Ask your provider what health promotion strategies you should start including in your life. Nobody knows your body and your life and your situation better than you, so make sure your provider is aware of everything going on and share some ideas, boundaries, and limitations that you are experiencing. Follow up on your lab work, your medication planning, and your referrals that your provider has been doing and ordering for you so that you're entirely in the loop. Stay up to date on health prevention strategies such as mammograms and prostate screenings. And encourage your provider to include spiritual care into your appointments if that is something that you like. And encourage your providers and allow your providers to give you holistic care. Give them insight into your emotional, spiritual, and psychological needs along with your physical ones. A lot of providers automatically want to jump to the conclusion that she's physically well, so she must be well in all aspects. But your provider won't know that there's an issue in one of those aspects if you don't make them aware. So if you're struggling emotionally, spiritually, or psychologically, that is something that you can talk to your provider about, and they can give you some techniques to improve your care in all areas. A historical figure that has really set the tone for holistic care is Hippocrates. Yes, even in ancient Greek times, holistic care was being studied. Hippocrates was an ancient Greek who focused on natural approaches to diseases and included social and natural environments in his care. According to his philosophy, a healthy mind leads to a healthy body. Hippocrates believed that physical exercise was essential to maintaining good health. He kind of talked about how during the Greek Olympics that, people were physically fit and that when they participated in the Olympics, their emotional well-being went up because they were staying active, staying healthy, and participating in a group setting. Greece promoted psychological support and did not only focus on symptoms of the disease. Hippocrates believed that art, music, and play were essential to the mind and to healing. He believed that the mind, soul, and spirit created a harmony within a person and would ultimately promote their health. So what is the opposite of personal care? It's basically to neglect your own health. It can be easy to neglect health when life gets busy and stressful and you can't even find the time to make an appointment. Perhaps you have had a few symptoms or a few issues for a few months and you've chose to ignore the signs because time didn't allow you to go to the doctor. Neglecting to have preventative screenings done such as mammograms, cervical screenings, prostate screenings, and colon cancer screenings is a neglect to your health. Ignoring the need to stay up to date on vaccinations is neglectful as well. Things like shingles is really preventable, but if you neglect the time to go get the vaccine, then you increase your risk of getting shingles. Another example is being passive at your doctor's appointments with your provider. It is discouraged to allow your provider to make all the medical decisions for you. Decisions should be made with a shared decision-making technique. You should always have an opinion about your healthcare plan. The next thing is poor habits. That is the complete opposite of personal health care. If you continue to smoke cigarettes, drink alcohol, and use illicit drugs, it automatically increases your risk of death, coronary artery disease, stroke, and much more. It's going to increase your mortality and your morbidity and the chances of you getting preventable diseases. A sedentary lifestyle of a poor diet and poor exercise is also not going to improve your personal health care. So, what are the steps to success with personal health? One step is to ask questions with your provider. Stay engaged and focused on what the plan of care involves. Ask questions regarding your medications, your labs, your imaging, and your referrals. Ask what you can do better to improve your emotional, psychological, physical, and spiritual health. Stay involved with your plan of care and hold yourself accountable. Practice honesty and tell the doctors when something isn't working for you or there's something at the appointment that bothered you. Be honest about what you might be lacking with emotional health or spiritual health, and always speak up when something isn't going as planned or you think something needs improvement. The first self-care we will look at is emotional self-care. When people think about being healthy, they usually immediately think of their physical health, but emotional health ultimately can have a really major impact on your physical health. So how can we improve our emotional self-care? You can journal. A lot of people don't like to practice this, but journaling is a way to express your emotions rather than letting them build up inside of you, and it can be an outlet for you to express yourself. Maybe if you had a really hard day at work and there's really no one you can turn to, you can journal it and kind of organize those emotions, how you've responded, and what you can do differently. Diet, exercise, and sleep are major components of physical health, but it can also improve emotional health. By exercising and eating well, it can boost your mood, improve your energy and focus, and prepare you for the day. Another emotional self-care technique is setting boundaries. So if you have people in your life that you are letting, really drag you down, or they're having a negative impact on your emotional well-being, set some boundaries with them and firm limit setting what you will allow that person to do. The last thing is to show grace towards people. So to be really emotionally self-aware, you have the ability to show people grace and treat everyone with kindness. Physical self-care involves diet. So eat lots of nutritious foods, get your daily intake of fruits, vegetables, dairy, get enough protein and fiber, and avoid foods high in fat and high fructose corn syrup. Exercise. It's important to get regular exercise. It's recommended to get about 150 minutes of exercise a week. And find an exercise that works best for you. Try different exercise routines and different styles and figure out what you enjoy. Try walking, yoga, weightlifting, running, dancing, or bicycling. If you find an exercise routine that you enjoy, you're more likely to stick to following up with that exercise routine. For sleep, it's important to get at least 7 to 9 hours of sleep per night. This is difficult for a lot of people to do, especially the older you get. So if you struggle with sleep hygiene, make sure you're putting away your cell phone. Make sure you're not watching TV before bed. Make sure that when you're laying in bed, all you're doing is trying to sleep. You should avoid reading a novel in bed or watching TV or being on your phone. Don't consume caffeine or food before bed. Don't exercise too close to when you want to go to sleep. And you can try a sound machine, a dark room, and make sure the room is nice and cool to promote sleep. The last thing is to make sure you go to your routine checkups with your primary care provider. At these appointments, you can address acute and chronic issues, but you can also discuss health promotion and prevention that's specific towards your age and your gender. When you keep up with your doctor, you can prevent preventable illnesses, and you can stay up to date on things like prevention, screening, and immunizations. Psychological self-care is important, as that psychological care can eventually impact your physical care. So therapy, it can be an outlet for expressing your concerns, your stress, grief, and life obstacles. A therapist is a non-biased person, so if you find yourself always venting to people that may be a little biased, or you find yourself always venting to the same person, maybe you can try therapy so you can have an outlet to always go to and someone who's always going to give you their non-biased opinion. And they can give you tips and tricks to how to handle different stressors that you come across in your life. And make sure you take breaks. So if there's a situation or people in your life that are not good for your mental health, create boundaries and set barriers to those people or situations that are not helping you in the long run. Create a positive work-life balance. So if you have a really stressful job, it's easier said than done, but try to leave work at work and try to do things at home that take your mind off of work. And lastly, participate in different activities. So maybe learn a new skill. A lot of people like to pick up sewing or stitching. You can read a book, find a genre that you like and stick to it. You can go on a walk, you can go be in nature, or find an activity that you like to enjoy. Maybe you like to go fishing or hiking. Now that it's summer, you can go outside and do different things. And take a break from electronics and social media. It can be really easy to be on social media and get wrapped up in what you feel like your life should look like. And being on electronics, you really get focused on the phone and the television and what's going on in the world, and you can put your phone away for a little bit and go do something to take your mind off things. Spiritual care is something that goes beyond religion. A lot of people hear spirit and automatically jump to religion, but having spirituality can give people a sense of purpose and a sense of self-worth, and it can ground people to here on earth. And sometimes spirituality means thinking about what's your purpose in life, what's the bigger picture. And spiritual care can encompass finding a passion, finding your purpose, and becoming connected. If you are religious and your spirituality is religious based, you can spend your time praying. If you're not a religious person, maybe you can spend your time meditating and you can clear your mind and relax your body. Spend time reflecting on your life, what has passed and what's to come, and what goals you have and how you can better try to find peace within yourself. Another thing is to practice showing compassion and grace towards others. A lot of people are just really unhappy with the world right now, and spirituality includes putting out into the world what you want to come back to you. So practice compassion and treating people with kindness can really improve your spirituality. Lastly, you can participate in gatherings such as with a church or with a small group. Maybe a gathering could be going to a Bible study if you're religious, but even going on a nature walk with someone who has similar values and beliefs as you is an example of how you can participate in spiritual self-care. So what is the highest standard of health and well-being? The highest standard is to be holistically well in all aspects of life, including physical, emotional, social, and spiritual. A lot of people make the presumption that, I'm physically healthy, so that means I'm healthy. That's not the goal of holistic care. It does not mean to simply be free from disease, but it means to be whole, healthy, and balanced in all of these aspects. You can be really physically healthy, but you can be really disconnected spiritually and emotionally. The highest standard of physical health would be to be free from illness, but also to have energy, nutrients, and develop healthy habits. So that would mean you have energy to go do tasks that you want to do every day. That would mean you don't smoke cigarettes, you don't drink alcohol. The highest standard of emotional health is the ability to cope with life's stressors and challenges. It would mean to be emotionally stable and self-aware, and it would mean to have healthy relationships, independence, and a sense of self-worth. So to be at the highest standard of emotional health would be if a life stressor is thrown at you, then you can handle it. If you are faced with a breakup, if you are emotionally stable, you'll be sad, but you can have a healthy level of independence and self-worth. Social well being includes having family, friends, and partners, and to really develop long lasting and meaningful relationships. It includes having a sense of community and involvement and having a place where you belong. So maybe you're emotionally and physically stable, but maybe you spend a lot of time by yourself, and maybe you're really lacking in having really strong bonded relationships with people. So maybe you can go participate in a book club or an exercise class. Lastly, the highest standard is spiritual well being, and that is having inner peace, a sense of purpose and belonging, and spending time with people who have the same beliefs and values that you have. Spiritual care is really important, and one of the biggest components is spending time with people who have the same beliefs as you, because then you will be able to lift each other up and encourage each other because you have the same beliefs and values. It means to have a feeling that there's a greater purpose of life and be connected with nature. So value dimensions can be used to facilitate communication and understand how different cultures work and how they will respond to different styles of leadership. This presentation would likely be responsive to those in either an individualistic or collectivistic culture. Individualists focus on their personal needs and their immediate family only, and these people are less likely to participate in a group setting. Those who participate in collectivism emphasize relationships and loyalty. Both audiences could receive valuable information from this presentation as I discuss individual development and what you can do for yourself, but also discuss how being in a group setting can improve all aspects of health from emotional to spiritual. This presentation would also probably focus more on a feminine culture. It's important to know that feminine in this context does not mean female or male. Instead, a feminine culture means that these people respond better to nurturing, caring. They focus on quality of life and relationships, whereas a masculine culture would respond better to assertiveness, competition, and control. In this presentation, I focus more on quality of life versus quantity. If you improve your quality of life, you're probably going to live longer, but that's not the goal of this presentation. I focus more on relationship building and self-nurturing and self-care. Lastly, the difference between short-term and long-term orientation is the emphasis on cultures and what they place gratification on in terms of social, emotional, and material needs. So short-term societies would focus more on short-term goals and what's going to impact them in the near future, what's going to impact them in a couple months. They have an emphasis on what's happening to them currently and what they can do to find satisfaction presently, whereas a long-term society is going to focus on what's going to happen to them in the long term. They value persistency and perseverance, and this presentation is likely to respond to long-term orientation audience because many changes to personal health care are ultimately going to improve your long term. For example, smoking cessation now is going to decrease the chance of you getting COPD or cancer later. And in short term, smoking cessation would be really hard. So this presentation would likely respond better to a long-term orientation audience.